Hello, my name is Demetrius Williams, and I'm performing dressing change central line video. I'm in my Nightingale scrubs. My badge is present. First thing I'm going to do is look at my doctor's order, verify the order. Then going to gather my supplies and head to the patient's room. Once I get to the patient's room, I'm going to go ahead and knock on the door, enter the room, and close the door behind me to ensure patient privacy. I'm then going to introduce myself to the patient. Hello, sir, how are you? My name is Nurse Williams. I'm here to perform your central line dressing change. Can you verify your name and date of birth, please? Okay, John, that's what I have here as well. We can go ahead and get started with that, okay? First thing I'm gonna do is get some hand hygiene, perform some hand hygiene. I'm then going to place a mask on myself first. Then I'm gonna place a mask on the patient. Here you go, John. Okay, after I've done that, I'm gonna go ahead and hand hygiene again and apply my clean gloves. Once the clean gloves are on, I'm gonna go ahead and remove the old dressing. I'm going to anchor the central line here so it's not moving, and then loosen the dressing on all four corners. 1, 2, 3, 4. And then go ahead and remove the dressing away from me. Once I've done that, I'm gonna go ahead and dispose of the dressing into the trash can. Once I've removed the old dressing, I'm gonna go ahead and ask the patient if he's in any pain. John, is there any pain, any discomfort going on? No? Okay, good. Then I'm also going to inspect the catheter, look for any dislodgement or if the catheter is kinked or anything. I'm also gonna inspect the insertion site, looking for any redness, swelling, drainage, things of that nature. So once I've done that and made sure that the insertion site is good and the surrounding skin is good, I'm gonna go ahead and remove my gloves. Go ahead and perform some hand hygiene. I'm then going to get my central line kit here, and I then want to open the kit away from me, and then go ahead and bend the side so it doesn't come down on the kit. I'm then going to remove my sterile gloves here. Okay, when removing the sterile gloves, I want to make sure I only use the 1-inch border on the paper wrapper to preserve sterility. Okay, once I have the paper on, the paper wrapper open, I'm going to go ahead and apply my sterile gloves. Once I have my dominant hand on, I'm going to use my non-dominant hand to scoop the glove up and apply the glove using the outer wrapper portion of the glove only. Once I have my sterile gloves on, I'm now going to be using sterile technique. I then will pinch my wrapper and dispose. Okay. Now that I have my sterile fill here, I'm gonna go ahead and grab my chlorhexidine swab. I'm gonna go ahead and crack the swab to make sure it's fully saturated. Once the swab is fully saturated, I am going to get some gauze here in order to hold the tube. So once I have the tubing held and the swab is fully saturated, I'm going to clean the area for 30 seconds. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So once I've cleaned the whole area that the Tegaderm is going to go on, I'm going to allow the area to dry completely. Once I've done that, I'm going to go ahead and dispose of my chlorhexidine swab. And once the area is dried completely, I'm going to go ahead and drop my central line back down here and dispose of my gauze. So once the area is cleaned and fully dry, then I want to apply the Tegaderm to the area. So I have my Tegaderm here. Dispose. Then I will apply my Tegaderm over the area, making sure the area was completely dry. So I'm applying my Tegaderm, making sure there are no bubbles, and making sure that it is secure. I am then going to remove the perforated around the line, making sure there are no bubbles or kinks. Once I have that and the Tegaderm is secure and the central line is secure, I'm going to initial the label with my initials, the date, and the time. Once I have that, I'm going to apply it next to the central line because you want to keep the line visible to look for any drainage and make sure the line is flowing freely. Once I've applied my label on there and the central line is secure without any bubbles or kinks, I am going to dispose of all any equipment here, dispose of my pen, and I'm going to discard my gloves. I'm going to make sure the patient's in a position of comfort. John, are you okay? Everything good? Okay. I'm going to perform some hand hygiene. I'm going to document the procedure, let the provider know, and document and let the doctor know that the procedure is done. Thank you.